Hello everybody. Today we are going to talk to Dr. Randeep Guleria, Director of the AIIMS, Delhi. We are going to talk to him about the ILD registry. There is a lot of noise about the ILD registry in India and now outside India also regarding the cases, type of the cases we are seeing in the ILD cases. So, good morning sir. Sir, I would like to know about your opinion about the ILD registry in India and how is it different from the developed countries?
So if you look at the data that is coming from India, and there is the ILD registry which has come, after which there is a paper which has come from PGI Chandigarh, which is also looking at ILD registry data from their center. It's a single center study, and there have been some other single center studies which have been published over the last few years from different parts of the country. The ILD registry is the largest database which we have. It also is multi-centric and has more than 1,000 patients of interstitial lung disease. Problem with the ILD registry has been the fact that the data is a little heterogeneous in the sense that quality of data has varied a lot. The diagnosis has been based mainly on clinico-radiological profile, and the transbronchial lung biopsies or the cryobiopsies or the open lung biopsies were very few, less than 10%. And therefore an issue as to the findings of the registry, because it came up with a surprising finding that majority of patients in the ILD registry were of hypersensitivity pneumonitis. In contrast, the registry which has come from PGI Chandigarh has come up with a different database. They are a single center study. The criteria for diagnosis is more robust in that study, but there is a center bias because PGI gets a lot of referrals for patients with sarcoid, and therefore in that registry sarcoid was the most common cause of interstitial lung disease as compared to the ILD registry. These are the two glaring differences between the two main data which is there. The other studies are of smaller number of cases, but I think what these two registries tell us is that there is heterogeneity in interstitial lung disease in our country. We need to have more robust data which is looking at good CT scans, higher number of biopsies, and a multidisciplinary approach in terms of trying to get a diagnosis which is of high quality with good inter-observer agreement. And then possibly if you're looking at the prevalence or the distribution of different diseases causing ILD, possibly it lies somewhere in between these two registries. I don't think we have so much of hypersensitivity pneumonitis. Possibly many of these patients did not have HP. I don't think we have so much of sarcoid. Many of these patients were there because of referral bias. And therefore, somewhere in between, we probably have the actual distribution of causes of interstitial lung disease. I think these two registries are paving the way for a large, multicentric, properly conducted study with more biopsies, more robust data, good multidisciplinary approach to get an accurate picture of the prevalence of different types of diseases causing interstitial lung disease in the developing world and especially in India.
So one more last question. So there's a speculation that air coolers is one of the most common cause of HP in India. What's your take on this?
So again, although the ILD registry showed that there was a correlation which was very weak between hypersensitivity pneumonitis and exposure to air coolers, there was really no cause and effect relationship that was shown because the study was not designed to look for that. And again, I would suggest that this study was more of a hypothesis generating study which tries to show a hypothesis that if hypersensitivity pneumonitis is a common cause of ILD in our country, one etiology that could be there could be the air coolers and the pads in the air coolers which may have fungal spores or other molds which may be causing ILD. But a cause and effect relationship is very important to prove any such hypothesis, which was not done in that study. So I think it's too premature to say that hypersensitivity pneumonitis is predominantly being caused by air coolers. But it is a study which raises that point, and it needs more research to really be able to show one way or the other whether that is true or not.